Really, alcoholic liver disease is really called alcoholic fatty liver disease because what happens when excess alcohol is consumed, it deposits fat into the liver, and that fat in turn causes inflammation in the liver. So really, it's alcoholic liver disease, but sometimes people may hear that they have a fatty liver, and that's related to alcohol. So I kind of want to make that clear. Really, we have to also talk about alcohol use disorder, which is the mental health disease that causes alcoholic liver disease. And I think that's the big thing, that this is a psychological or a brain disorder. And oftentimes, we hear, why can't someone just stop, or why can't anyone, just you could be stronger than this. But we understand this is a disease, and this disease, like any other, needs treatment. And this disease is categorized from mild, moderate to severe here. So this is something that really, we don't call it alcoholism or anymore. It's called alcohol use disorder, which is the actual disease that we're going to be talking about today. And so you can see here, because it is a disease, it has a very busy diagnostic criteria here, and really kind of what the big things that we kind of look at, as you can see through here, that with patients, it's really kind of measured within a year if alcohol is taken in larger amounts or longer periods than intended. And we'll talk about the amounts of alcohol later on in the presentation, but really a lot of it comes down to like a desire of alcohol or unsuccessful efforts to kind of stop or cut down or control their alcohol use. A lot of their daily activities are spent with, using alcohol, talking about alcohol, or kind of recovering from that. When they have cravings of alcohol or recurrent use of alcohol that kind of interferes with the daily life, work, family, and things like that as well. And then, using it when situations are physically hazardous, such as drinking and driving, or going to work and drinking. So this kind of briefly, this is kind of what we look at when we say someone has alcohol use disorder, and things for people to kind of, as physicians and clinicians, kind of recognizing this in our patients, and for those folks out there who, recognize it in themselves or in their family members, and making sure that they get the treatment that they need for this.